All right, let's get started. Boy, you know, a topic is hot when you start to see the attendee list just keep piling up and piling up. So thank you for attending. My name is Rob Messmer, Sales Vice President and Channel Chief for CBTS. And seeing a lot of the names on the list, many of you are some of our trusted advisors around the country that talk to their customers about services from a lot of different providers, and including CBTS. So we want to thank you for your trust in our business. And really, our mantra in this space is to make heroes out of you in the solutions that you bring to your customers, and in the end, bring value to your customers. This topic is interesting. If I set out at the beginning of this year and said that we would be offering this kind of solution, I would have not believed you. But with these different times, our customers and you have asked us for solutions in new ways. And one of those things, as we return to work, is around this concept of thermal monitoring. And I'm pleased to have a couple folks with us today. Steve Lankard, who's the VP and runs our infrastructure practice at CBTS, is on the phone or on the webcast. We've got John Radcliff, a subject matter expert on his team, that will be taking you through some of the information here. And then, who many of you know, Matt Douglas, a senior sales engineer that runs sales engineering for our indirect channel at CBTS. We'll kind of give you then a backdrop on how these services fit into our overall offering that you can bring to your clients. So with that, I'll kick it off to Steve. I will say, you know, this is a different product than we've seen in the channel, and that's somewhat intentional. We are trying to be very nimble. We are answering some really important questions that customers are asking to get back to work. And the solution sets that you're going to hear about today are really focused on getting those answers quickly to customers. And there's a lot of noise in this industry, particularly in the thermal monitoring space. A lot of questions, a lot of, you know, where are these things sourced? What about data? What about, there's a lot in that. And we've done, and hats off to Steve Lankard's team for really vetting a lot of the products and services so that your customers can have an offering that is sound and one that they can trust. As you'll see, this is not a service that we're bringing to market for us to make our year or number on, and we don't think it's something that anyone should really. It's by design to answer a customer need first and foremost. And it's not something that is going to make anybody's quarter or year, but really, again, focus on the customer. So with that, Steve, I'm going to kick it off to you, and welcome.
Great. Thanks, Rob. Can you guys hear me okay? Great. So thanks, everybody, for joining us today and spend some time with us to learn about thermal monitoring. These are strange times indeed that we're all in. That's what I look like with a haircut and when I work out, and this is what I look like during a pandemic. I hope that you, your families, your coworkers, and your companies are all safe and healthy. My name, as Rob said, is Steve Lankard. I'm responsible for the infrastructure business here at CBTS. And as our customers begin to return to work and school during this pandemic, they're challenged with doing so as safely as possible. A couple of weeks, about a month ago, our customers started asking us, do you guys have any solutions to quickly measure the temperature of people about to enter our buildings? They were looking to add a level of scrutiny and security screening that measures if people entering their facility have a fever or an elevated temperature. And we looked at a lot of solutions out there, and there are a lot of solutions out there. We had to look at a bunch of factors: supply chain, product availability, device accuracy, and reputational risk. And what I mean by that, a lot of these companies that make these devices use code that have concerning origins to the government from a security standpoint, especially those that do biometric capture. So we worked to limit the risk in our offerings, and we determined that the Meridian Kiosk solution, which is built upon Hewlett-Packard Inc. technology, was effective to solve the stated problem in a particular use case. As Rob said, this is not a solution that's expensive. It's not a solution that's going to diagnose illness. It's not an FDA-approved device. It measures temperature and alerts when someone is measured as having an elevated temperature. And then additional measures can be taken based on the company's policies, and they vary from company to company. These are not big ticket items, and they don't present a recurring revenue stream. What they are relevant in helping our customers come back to work. There are ways to get your customers to see you as helping them, as trying to find ways to get them to return to work and school more safely. These are solutions that we have not provided in the past. I assigned 2 of my senior architects to act as subject matter experts and do all that requirements gathering and product detail vetting. The team has done a great job in working together, and they pulled together what you're going to see today. John Radcliff is one of the SMEs, and he'll be presenting to you shortly. We're going to provide you a brief overview of the solution and use case that we have defined, and then we're going to open up for questions. And I want you also all to understand this area, this market is moving very quickly, and it's evolving very quickly. And we're looking at other options and use cases that we may add in the future, and if we do, we will communicate them to you. John Radcliff is now going to take us through a quick overview of this use case. John.
Thanks, Steve. Appreciate that. Nice to see everybody today. As we go through the next few slides, we'll kind of hit on where we've been and where we're at, and hopefully where we're headed to. So the main question we always get, right, is why thermal monitoring? Back in April, the Department of Health and Human Services, put out a message that stated, hey, you can't tell whether a person's sick or not by taking their temperature. However, coming through COVID and the pandemic, they realize it's a great first step to ensuring a safe workplace or a school place. So what they advise is you're allowed to use these telethermographic devices to act as a screen or a triage point. And that kind of brings us to a great legal point. These are not FDA-approved devices. They are intended to just indicate or provide an indication on whether someone may or may not have a temperature, and then should be directed to an FDA-approved thermal device scanner that can actually take an accurate measurement and provide you a true answer on that. And the reason we always bring that up is there is a variance of accuracy in all these devices, and we will get that as we step through our process. Gabby, could you go to the next slide? So a lot of companies right now, a lot of states, I know of 3 directly, Ohio, Pennsylvania, and New York, are requiring employees to have their temperature taken upon entry to an establishment or an employment place of employment. The first ditch response is I'm going to stick a nurse or a receptionist or a guard at the door, and they're going to have to take everybody's temperature and write it down. All right. How could that cause a problem, right? Well, you're putting everybody at risk by being in close contact, but most of the handheld devices out there now take between 20 and 60 seconds to take someone's temperature. The problem with that becomes, even if you only have 10 people trying to come through the door, you end up with that, what we call a gaggle effect in the lobby, and it really makes it hard to maintain that 6 feet of separation for social distancing while you're waiting. And obviously 10 people could easily take 5 minutes to come through. So how do we apply technology and the resources that we have to make that faster? And that's what brings us to our solution and our use case. Abby, can you hit the next one? So our primary use case, I would say, out of the customers I've spoken with, 85 to 90% of them fall in this use case. I need to get my employees back to work. I can't afford to stick someone at the door taking everyone's temperature, or use my receptionist to take everybody's temperature when they need to be doing their job. What we have here is a kiosk that is the simplest method or device that we've found to deploy. It's totally customer installable. They ship to, they pull it from the box, they stand it up, plug it in, you change the password, verify that it's up and running, and you're rolling. Now your receptionist just has to be back doing their own job and watching as people come through and they step up. They only have to be within 18 inches. The scan time is sub 3 seconds. So now that same people where before would take up to 5 to 10 minutes to come through, now only takes about a minute. So you can see how that speeds up the process of folks coming to work. And if they do have a red indication, they step over, maybe the receptionist only has to take those temperatures. As we wrap policy and procedure around this, you'll find your customers are struggling with that. The guidelines are changing every day, as Steve mentioned, and staying on top of that is going to keep this a little bit in flux for now. But having that policy to step up, get your temperature taken, if you flash red, have a process in place to have them get a better temperature take. And eventually, and I say eventually, but typically what I expect to happen is as we get back into the social ramifications of, hey, I don't feel good, or I'm sick, I'm going to go home, or I'm going to work from home, because that's an option today. And this process helps get folks back in, gets them going. And I do kind of want to stop here for a second to see if we have any questions, as I see some already coming in, and we'll kind of keep this interactive as we step through. So what's our first question? Go ahead, Gabby.
So currently the only question so far is asking if we are going to be providing a handout or data sheet over this. So yes, I will provide a PDF of this deck for all of you once the webcast is over. And then also we can provide the HPI data sheets that they have as well.
Thank you. Mm-hmm. So as we see this slide, let's look at some of the benefits of the HPI Meridian kiosk device, besides the fact that it's easy to install, right? This comes with the ability of facial recognition, although that's disabled by default due to multiple states that may include that as PII. You don't need to have the facial recognition for this to scan people's temperature. It's intended on being there, being quick. It can also validate, if you have a policy, that you must have a face mask to enter the facility. As you can see here, they'll step up. It can still tell it's a human, validate it has a face mask, take their temperature, and step through. You can connect it to an audible alarm to where if you wanted to ding a bell or run a siren at the same time, you could for those that get registered. So let's step to the next. I was going to say step us to the next slide, Abby. Go ahead.
A couple of questions did come in. Do you have to touch your hand to the device, or?
No, this is a completely touchless device, and that's where I was.
And then how does this solution comply with CPPA?
The PPA?
Yes, CPPA.
Oh, CPPA. I'm not familiar with, can you explain the acronym for me, Gabby? Because I've seen so many of them, I want to make sure I answer the correct one.
Hold on one second.
Is that the Customer Protection Act?
Oh, California Consumer Privacy Act.
Correct. Because this doesn't collect any information and it has no way to tie that back, there's nothing collected to be concerned with on the privacy side. That makes sense?
Okay. Yep, that's great.
Yeah, because that kind of also goes along with the PII and the HIPAA guidelines. So this slide's great because it kind of just gives a high level of the points that we've kind of already talked about. This has a variance of 0.9 degrees. That was one of the things that Carol and I looked at, was trying to find accurate devices as well as a price point that's acceptable by a customer. It does have limited integration with access control, but again, we're not selling it that way. But we want to bring that up because there is some small situation there. The support on this is through a warranty, return to depot, So if you're having problems right away, it's as simple as calling the 866 support line for Meridian, and you select support, and it'll take you right into support. You could also email the help at M0 or visit their support website, and they will take you through, help you go through some limited troubleshooting if you are having a problem or perceive you're having a problem. And if it's bad, you ship it back. They'll give you the RMA and they'll send you a new one. So it's quite straightforward. The one thing I like to discuss a little bit is a question I commonly get, although not yet today, is do I have to calibrate it? How hard is it? These devices are meant to be inside a environment and controlled space, right? And I bring that up because none of these IR devices will work outside in the elements. Wind and direct sunlight will affect the readings on any of these, including handhelds, if you were not aware of that. So by setting them up in the controlled atmosphere, you can go into the settings. It will tell you what the room temperature is. That's easy enough for you to validate. And then normally the calibration cycle is you go into the calibration and take your temperature with an accurate FDA approved device, scan yourself here, and then put in the difference in that variance, and that will actually help tune it. Now the manufacturers will state that you do not have to ever calibrate the device. But most folks we've talked to will say, because we live in a four season zone, once a season is probably not a bad idea. I have spoken to some customers that their policy will be to calibrate it weekly, and some will even do it daily, just because they don't want to take any risks.
And John, just to answer the question from before, this is a touchless process. The backdrop on the previous slide was a kind of marketing stock picture, but this is the actual
Correct.
device itself.
Yes, this is typically once you step within the 18 inches of the device, it'll tell you what direction to adjust your face, and it'll take your temperature in under 3 seconds.
So a couple of questions have come through. Does this work for employee or anyone visiting the building?
That's a great question. What I normally see is both, right? We have companies that are deploying this to get their employees back in, and I always give my wife credit every chance I get, but she had a great saying with these devices. She said, "You're not selling technology, you're selling confidence." Right. So when you step up and you see the device and you're taking your temperature before entering, it's going to make you feel better that, hey, nobody's coming in here that has a temperature. I've seen these deployed in retail spaces. One I always bring up is the kidney dialysis clinic in Cleveland. They're deploying them in the beginning of their lobby. So when their patients come in for their appointments, if it's green, they proceed to the lobby, and if it's red, they go to the clean room or the quarantine room. They're not going to decline them their dialysis, right? Obviously, but they're going to keep their patients separate and safe.
Okay. Is HP Inc. and all of their channel partners able to sell this solution also?
So the answer is yes. I normally, Steve usually has a better answer to that. I always just let him step in. The right answer is the correct answer. This is an openly sourced product, so yes.
Okay. Are these products made in the USA? If not, where?
So this is a collaboration between HP Inc. and Meridian. Meridian is HP Inc.'s Kiosk company. So it's kind of both. There are multiple places of manufacture.
Okay. How does the temperature actually get taken?
So it's through an infrared detection. So the facial recognition software actually helps tell the IR where to point, and then it's scanning across your forehead for the surface, and it pulls around the eyes and across the forehead. So it's an infrared scanner similar to what you would use on a handheld.
Okay. Is internet connectivity required?
It is not required.
And does this have black body radiation capabilities?
No, it does not. Because
this a
remember,
good-
the idea of this device was to keep the price point low, right, for the customer.
Is this a good product for schools who have hundreds of kids coming and going?
See, it's funny you mentioned that. That was the first question I had, since I do have, she's going to turn 8 tomorrow, my daughter. What I find is elementary and junior high kids, these devices actually work great. The kids find it cool to be able to go up and get their temperature scanned. And normally the nurse is standing off to the side. And if you've got a whole bus or 2 buses coming off at once, you just have 2 set up 6 feet apart, right? So you create more parallel lines. The high schools, there's more discussions around that, right? Because you start getting into the individual student identities at that point.
John, why don't, if you don't mind, talk about the time it takes to take someone's temperature with this versus other devices that you screened.
Right. So I mentioned a little bit earlier, the average handheld device takes anywhere from 20 to 60 seconds. Usually 30 seconds is the average take time. So you could imagine trying to take that 100 school kids one at a time, or even if they had 3 nurses at 30 seconds on average is rough. To go sub 3 seconds, that's pretty quick. I mean, that really, when you can take 10 at the time it takes, 1 on average, that really speeds up the process. Kind of grows exponentially.
Okay. Can you explain how effective this device is if someone is asymptomatic?
So therein lies the number one problem that's been pointed out by the CDC and the U.S. Department of Health and Human Services, right? Somebody that's asymptomatic is not going to show a fever. So, and that's the idea of this, is to help locate the ones with a fever.
If I could add to that, John, again, this does not diagnose COVID-19. This identifies an elevated temperature. Someone can have COVID-19 and not have an elevated temperature. So this just addresses a subset of people who should be looked at further based upon their temperature being elevated.
Okay. Our team supports a lot of retirement communities. Any consideration of a specific use case for retirement communities and nursing homes?
Yes, another use case that hits close to home for me. But for me, when I was entering a nursing home to see my mother, they usually had a guard or receptionist there, right? Because they didn't just let anybody in. It's an easy kiosk to set up. Nobody comes in that's running a fever. The other place I've seen it in hospitals is as nurses are traversing between departments and memory units and different floors or areas, wings. These are set up outside the door, and it's a quick scan instead of having to check themselves with that 20 to 60 second delay, right? So that's actually adding a level of confidence and check, boom, boom. And you can do it throughout the day. So you may not have a fever this morning, but in 2 hours, maybe you did develop a fever. And it does add a nice convenient check.
Okay. Are any of these products / components sourced from China?
So all of the components within this device are clear from any of the blacklists or suspect code or chipsets. I don't know if that directly answers your question or not. It's hard to get away from something part of it being. Go ahead, Steve.
I think virtually everything that is electronic has some connection to China. The concern, right, is there malicious code or processors in the system that would make the government suspicious and concerned. And this has been vetted through contacts that we have, and they have not provided us any concern, while they provided us concern over others that you don't see being presented today.
Okay. Will wearing a mask affect the accuracy of the temperature taken?
No, it will not, because the temperature is taken from around the eyes and the forehead. The mask does not impede with that.
There was a mention of states requiring temp checks. Can this list and details be provided?
Yeah, the three states I know for a fact are Pennsylvania, New York, and Ohio, because I've actually looked at their guidelines. I'm still working on looking at some of the other states.
Okay.
And usually you can go to the governor's websites is where I have found all that information.
Okay. Does one unit work for people of all heights? For example,
Yeah,
a 10-person versus a kid.
Right, and this pedestal device is set at about 1.5 meters tall, which is usually right around 5 foot. So you tall people like Steve have to duck a little bit, and then us short people like me have to raise up a little bit. And I would, in the case of the kids, and one thing to remember as we go into the future, later this month, we'll talk a little bit about futures. They are coming out with a desktop mount for this device, which could lower it if you needed to mount it on a shorter desk.
Okay. Is there a different service level or benefit from buying through CBTS / the partner channel or going direct through Meridian? Asking because I see a delta of $250 that Meridian publishes on their website. I want to be able to tell my clients why they should go through us.
I know my personal feelings towards it, but I'll let Rob answer that one.
Yeah, I can answer that. What you see as the list price is a suggested retail price in the market. You can work with your channel manager to determine what price you want to end at for your customer, and we have flexibility there. There is value in as Steve mentioned, we've vetted several different types of devices, and then which now gives us a level of subject matter expertise that that we can complement HPI's warranty program with subject matter experts once the customer is installed.
Okay. What is considered an elevated temperature? What is the temp used as normal, as this is no longer the 98.6?
That's a great question, and if I failed to mention that earlier, I appreciate you asking it. So the CDC and the U.S. Department of Health have identified 100.4 degrees Fahrenheit as an indication of a high, elevated temperature. Anybody over that should be checked closer.
Okay. Is this a one-time sale or recurring revenue? Sorry, that's the question. Is this a one-time sale or a recurring revenue?
So the device itself is a one-time sale.
Okay. Does the temperature of the room affect the accuracy of the temp scanning? What is the range of temp the device can be placed in?
So we can include, the range is included in the spec sheet that the Abbey will send out to everybody, that you can see that. And because it's taking the temperature of the room at the tablet itself, it actually is what it uses to help keep it accurate. So it knows what temperature is. So when it scans the person standing in front of it.
Okay. Do you have any case studies for churches?
So the church, I did speak with the church out of Columbus, and they were looking at it to let their congregation step in front of and scan in their area before entering the church. And the reason behind that, again, was a confidence. Because they still haven't been allowed to return to church yet, they were purchasing one just for the fact of the clergy or the directors to use for their meetings.
Is there a worldwide warranty and or spare kit available?
The warranty is worldwide, the return to depot warranty of 1 year. And the spares are at the depot.
Okay. Is the pedestal / post shown in the picture included?
Yes. Everything you see there is exactly what you get in the box.
Okay. Can this count inflow / outflow of people?
Right now, I would say no. That is one of the items that has been brought up for their software development team, and I would list that as their future.
Can this scan multiple people at once or just one person at a time?
Just one person at a time.
And then how much as a partner do we make on this?
And I can handle that. Work with your channel manager on that, and we can get back to you.
Will HP Inc. give big deal discounts? This is their way of giving discounts for major accounts for this solution.
Read that again, Gabby. Go ahead.
They're asking about escalated pricing, big deal discounts. It is my understanding, and we will follow up and respond back to you that no, they don't do that. This is a unique issue with a unique supply and demand issue. They're pumping these out, and they're not doing large volume discounts that I have determined, but I will get back to you.
Are these devices on back order? What's a realistic date to expect delivery?
Right now, the lead times are 3 to 4 weeks. I can tell you at the beginning of last week, they were closer to 6. They have increased their production to 1,000 units a day, and that is what's brought it back down to the 3 to 4 weeks. And their goal is to get it down to 2 to 3.
Okay. Can the system be integrated with a building's access management system?
It is very limited. It is very limited, and that's on their development list. But right now, it's very limited, so I would not advise it.
Which communication platforms can this connect to? Example: Slack, Outlook, Microsoft, etc.
Right now, it's a standalone device. It doesn't connect to anything.
Okay.
John, this is Matt. In regards to that, do you want to talk a little bit forward thinking about the possible cloud connectivity? And then
Yes.
There was also a question earlier, a thought about what kind of data does this store? What's the analytics I can use of maybe how many people had a temperature that day, how many people it scanned, those kinds of things.
Right. So last Friday, HPI and Meridian GA'd a cloud software as a service tool called M0 Manage. They have not released the pricing on that. We are anxiously waiting, of course. That will be a subscription-based software as a service that will help provide the reporting to what what Matt had just mentioned. The key being, hey, some states are requiring a list of or a report of how many hits per day you had or per week, and that's where that reporting will come in. And it also allows you to manage more than one of these devices at a time. And it will be as simple as once you fire up the subscription, you log into it and then register your device to that particular cloud instance, and then you're up and running. And that's where you will see in the future the expansion of email reports automated and the integrations with some of the other Office 365 pieces that you see there. But they're very, very light on their sheets at the moment for what they've provided out.
Okay.
Yeah, I think there's been a lot of really...
The customers that we have are ordering the equipment now, knowing that the software, they'll have it within a couple of weeks, probably by the time they get their equipment.
Does this equipment need a power source?
Yes, you would have to. That's why I meant when you pull it out, you plug it in to get the power up.
Okay, is the device voice prompted or only, or does it have caption available for hearing impaired?
Right now, it's caption, right, and it does have some voice. Depending on as you step up, it says move to the left or to the right. But you will see on the screen at the same time, it'll say move to the left, to the right. But it's intended to be totally non-touched, right?
similar devices sold in the big box stores?
I have not seen these out of the big box stores.
Nor have I.
Okay. Does a person have to be standing still to take the temperature, or can it scan as the person walks into the building without stopping?
For the temperature to work, you need to stand relatively still for the just under 3 seconds for it to register that. If it was just facial recognition, those settings are below 2 seconds. So you could, but the point of these is for temperature, right? So you're going to have to stand still.
Okay. If there are multiple deployments in an organization, can there be a single point of management / some sort of UI?
And that is the M0 Manage that they just released as the software as a service.
Okay. What happens if the storage on the equipment is maxed?
So it's set by default to roll its storage, and that'll go based off of time or size. Right now, nobody that I've spoken with that hasn't deployed has ever had a storage issue. Usually they're rolling it every 2 weeks or less. Some even have it a month, depends on the traffic, right? But you're not going to fill up the space.
Okay. And then is this a one-time or monthly cost?
This is a one-time sell.
Okay. Is this managed by CBTS, or is this a purchase with manufacturer warranty and manufacturer support only? What other costs other than initial equipment of $3,150?
That is it.
Okay. So this is managed mainly by the manufacturer, correct? Not by
Correct.
CBTS. Okay. Is the infrared scanner sanitized after every use?
Because it's not coming in contact, you shouldn't need to sanitize, but it depends on your policy of the workplace. You may require someone to go through and sanitize it periodically. That was one of the beautiful points about this. You're not coming in contact with it.
Can you sell to any size business?
I would say yes, because sometimes if you have more people coming through at once, you might need more than one, right, to create your parallel line.
Who is the manufacturer of the camera itself?
That is HP Inc.
Can you repeat again the seconds it takes between each reading?
The reading itself is sub 2 seconds, and then it's immediately ready for the next scan. Sub 3 seconds, sorry.
And then this needs to be plugged in, correct? It does not come with a battery.
Correct.
The outside temperature, for example, with living in Las Vegas, with it being hot, that would not affect the reading, correct?
Because you're in a environmentally controlled room, it will not. What I will tell you though, and honestly aside, if you come in from outside and it's 102 degrees and step right up to it, it's probably going to read high, right? But what we have found and what the manufacturers are stating, usually if you give yourself 15, 20, or 30 seconds in that room before stepping up to it, your surface is fine. We just talked to a business yesterday in Michigan who said, well, they have a policy because they've already found this on the handhelds that if they read high, their first step is have the employee sit down for about a minute and then retake their temperature.
Okay. So if CBTS is now a subject matter expert, do we get a project manager or some other support asset for turn up and successful implementation?
I don't know, Steve, do you want to take that question?
Yeah, you won't, not a project manager, but for opportunities, as long as we have folks available, If there's questions that need to be answered or discussions that need to be had, we'll help you out with a subject matter expert like John or Carol as needed. It has to be, I mean, there's a lot of people on this call, and we'll have to do that based upon opportunity.
Yeah, and Steve, I think we pointed this out earlier. These are self-installed by the customer by design. So your customer should be able to install this on their own. And what Steve's talking about is we can complement, those kind of questions with our subject matter experts, based on volume. I think it's Go ahead, Gabby.
Sorry. Two more, just a couple more. When cloud analytics is available, will the connectivity be network or IoT?
It will be network. At that point, to use the software, you would have to apply it to your network with an IP address and then register it to that cloud instance. All communications would be SSL encrypted.
If this is installed in a gym that currently has facial recognition as a keyless entry system, will it tie into that system, or should both be completely separate systems?
I would deploy it as separate, because that way you're just using this as a temperature scan, right?
And then do you believe this is ideal for restaurants?
Go ahead, Rob.
No, go ahead, Gabby.
Sorry, last question. Do you believe this would be ideal for restaurants?
I believe it could be. If you had this set up by the hostess stand, as people come in, they would be able to scan their temperature before going to the table. And if they turned red or something, you would have to say, hey, we need to take your temperature, right? And that would be part of the policy that you're publishing out.
Yeah, and I think it's important to state, that this is an interesting environment right now that your customers are going through. And Steve's team really went through that vetting process. And at one point we had a whole, looked at a lot of different providers, and the deep end of the requirements, it gets deep very quick when you look at, do you want a device that has access control and data? And as you start to get very complex, your decision matrix on, where does that data, where is it kept, where is it sourced, out of what countries? And then you start seeing some of that data collection might be in the blacklist from government institutions. The other thing is the price points as you go down that path are exponentially higher. So where we landed as an organization was to let's get something that's intentionally a standalone that we feel, as Steve said, is gets businesses back to work, that allows them to triage this at a price point that they can handle. So we may come out with additional devices and manufacturers, but we're going to hit on all those key metrics and in the matrix so that you feel comfortable, your customer feels comfortable. But where we landed and where we see a lot of customers end up landing when they really go through all their requirements is we need to get back to work, and a standalone device lets us feel most safe. So that's why we're introducing it at this point in the industry.
Yeah, I'll add this too. John also looks very closely at lead times. And this device appears, right, to have the best lead times. As you move up to these thermographic use cases, lead times are getting longer and longer and longer. They're pumping these out pretty effectively.
Yeah, that's another part of that decision matrix is you might find the right manufacturer that has the exact interconnectivity to your office and door alarms and everything, but it might be many months before you even can order the device. So we want to arm our trusted advisors with technology that can can really help businesses get up and running quickly. With that, I did want to transition the webcast to Matt Douglas. Matt, if you could maybe kind of pull back and say, where does this fit within the overall CBTS umbrella and our channel program in general?
Absolutely. Yeah, Gabby, go ahead. I think, and pull the next slide up. And I think you can go through this. You guys are pretty familiar that we're part of CBB, New York Stock Exchange, and CBTS itself is about $1 billion a year IT services group. About 50% of our business is in managed services. I think most of you are aware of that. Go ahead, Gabby. What I wanted to focus on here was a couple of new things that maybe some of you don't know. We call this our 4 pillars presentation, kind of the 4 big pillars of value proposition that we've been bringing the channel and having so much success with partners like you guys here on the phone. And I hope you're aware, right, that we have on the left there the entire Cisco UCaaS and CCaaS and WebEx solution. Many of you right in the channel here as a customer had wanted Cisco solutions in the past. That got sold as a CapEx piece through some local VAR, and we in the channel never made any money with that. And CBTS has been at the forefront really of taking Cisco solutions, whether it's UCaaS, CCaaS, WebEx, or in the entire Cisco Meraki stack, and turning that into a managed OpEx service, that pays you the kind of commissions and give the customers the kind of value they're expecting in a fully managed solution. But what's a little new that I wanted to show you here is a couple of things, particularly on the right-hand side, you see the word multi-platform cloud security. And some of you may have seen some of the webcasts that we're doing. We're starting to do webcasts on this whole sector right here, doing it webcasts both partner-facing to educate partners like yourself, but also starting to work with some individual partners in doing these events in their customer base. And many of you probably are familiar with the fact that the new SD-WAN technologies are really changing how people look at the security landscape. Because oftentimes in the past, we just took all, in the MPLS world, we took all of our users' traffic back to a common data center or headquarters, and we had one or a couple of firewalls there. But as we move to the new kind of SD-WAN paradigms, what's going to be our security posture? And is it going to be the same for employees as it is for guest, maybe guest access or SSIDs? And so people are having to relook at what some of that security, stance is. And people are starting to look at cloud security. And maybe some of you in the industry, some of you here have heard of names like Zscaler and Palo Alto. You probably heard the name Checkpoint, which is, if you kind of take a look at reports like Frost and Sullivan or Gartner, you look at kind of the key names in security or Cisco, Palo Alto, Checkpoint, some of those names. Checkpoint's always been right up there in the right-hand quadrant, if you would. And Checkpoint has released a cloud security product that we've had a lot of experience in the past with both Palo Alto Prisma's cloud security and Zscaler's cloud security. And we've done a lot of work with those customers, connecting them particularly into VeloCloud instances. And Checkpoint really has come out with a new cloud security product that not only is it a better price point at Zscaler and Palo Alto Prisma, it has actually more features and functionality and better control, we think. And so we're very excited. We really just announced this here first quarter in 2020. Excited that we are the first service provider, managed service provider in an SD-WAN arena to have Checkpoint as part of the solution here. And that stack really comes with a full UTM, full unified threat management stack you'd expect of web filtering, IDS, IPS, application control, SSL decryption you see on the screen here, sandboxing, taking a look at every single thing that goes in and out of your network on the email side. And it also incorporates a VPN client. One of the difficulties in the Zscaler and Palo solutions are that the VPN client is a separate kind of a platform. It's a different price point. And Checkpoint really has put this right in the offering so that you maybe a Checkpoint you take and you move your firewall now to the cloud, you move your day zero kind of attack plane to the cloud, And as well, all your users get a VPN client that they can come back into your network to get to accesses, or it protects those mobile devices when they travel. So we'd be very excited to go in some more detail with you, with your team, or do some partner-facing events as well to go through some of these new cloud security offerings. Checkpoint is one, and we also do Cisco Umbrella too. The last point I want to make right here is in the SD-WAN side, and many of you have probably seen us talk about this multi-platform SD-WAN practice we have, and we're one of VeloCloud's leaders. We're actually VeloCloud's reigning partner of the year right now. We have over 5,000 installations of VeloCloud out there. Same kind of number on the Meraki side. You've seen us mention Viptela in the past, but we've made a lot of changes in our Viptela offering, particularly for a global scale. A lot of you, again, on the webcast here, probably familiar with the names Cato or Ariaika that have really made their names for global installations because they've got a low latency backhaul network. They can take traffic coming out of Europe and put it across their low latency fiber back to the US, and that's cleaner and quicker than just running that across the internet. We're actually the first to market here in the United States in the channel here. Our Viptela product has a series of global POPs and low latency backhaul network as well. So you can think about all of the advantages of the Cisco Viptela brand, its capabilities on site to site, site to data center, but combine that with a low latency backhaul network like you'd see with the Ariaika or Cato. And we're starting to see some real big interest in that. So that's another area as well we'd love to explore with you. So I just want, again, I think we want to end up here just showing you, reminding you that here's the 4 pillars we'd love to help you with. In particular, we've got, constantly adding things to it here. We've got some big changes on the cloud security side we'd like to explore with you. And the Viptela product, we're starting to see a lot of interest because it's really turning into a global offering with this low latency backhaul network. So I'll turn it back to you, Rob.
Thanks, Matt. As Gabby mentioned, this presentation will be available to you and sent out. And again, thank you to John Radcliff, Steve Lankard, and Matt Douglas. And please feel free to contact your channel manager if you have any questions. I think there were a couple questions we didn't get to. We'll either point your channel manager to you, or if you have questions, reach out to them. Thank you very much.